This is a general outline of the kind of people who are sort of obligated to fast and the ones who are given some kind of concession in terms of fasting or exemptions related to fasting. So first of all, I'm just going to go through this briefly, and then inshallah we'll get plenty of opportunity to talk through this in detail. So if you're generally under the age of 12 years, so under the age of puberty, so if you have not achieved bulugh, then in that instance, then it is not mandatory on you to fast, though it is encouraged for you to fast in your early years, be prior to achieving maturity, so that your body is accustomed to this sort of ritual during fasting where you are abstaining from food. So it's highly recommended that children do fast a few years even prior to achieving puberty. The other group of people are people who are incapable of fasting due to, number one, physical illness. So if you have a physical illness, then on the basis of that, you would be exempt from fasting. And this would suggest things like, for example, that you're acutely unwell. For example, you may be elderly, you may be frail, you may have an acute illness. And this would also be an exemption for you not to fast. Okay, so other conditions would be, for example, terminal disease. So if you have an end-of-life condition, so these patients will be required to offer fidya. We'll talk a bit about those concepts later on. Then there's those individuals who have chronic diseases. So for example, diabetes and bronchitis, COPD. So these patients will be required to offer compensation and fidya if they fulfill the criteria that they are that unwell that it would be difficult for them to fast. Then we also have individuals who have mental illnesses, so or learning impaired, who may have poor insight, poor understanding, what we consider as tamyiz, being able to differentiate between right and wrong. And those kind of individuals would, in this instance, be considered as exempt from fasting as well. We also have pregnant women or breastfeeding mothers whose health or child's health will suffer from fasting. So by default, they're expected to fast. But however, if their health is deteriorates as a result of fasting, then they are also exempt from fasting. And they can also make up days, qada, on alternate time. Then we also have menstruating women. So these are women on haid, so they are menstruating women or women with postpartum bleeding, so nifas. So these kind of women do not fast because they're not in a ritually pure state to fast. And for that reason, they make up the fast at an alternate time. And then finally, like the verse stipulates regarding those who are in safar, those who are musafir, they are traveling, they are also considered as being exempt with those conditions in relation to fasting due to hardship.